Hello, everyone. Thank you for joining us. I am again Nadir Carlson, the Membership and Communications Coordinator for the National Association of Social Workers Wisconsin chapter. We have just launched a poll that we would love for you to complete um, while I introduce our main speaker.
There's three questions on the poll, so please answer all three of them. It helps with the how to move through the content today.
Okay. Um, Actually, Jeannie Wagner, do you want to just introduce yourself?
Sure. Hi, everyone. I'm Jeannie Wagner, um, and I am a clinical professor emeritus with UW-Milwaukee. I was the field education director for 19 years there, but I'm also an LCSW, and I was practicing social worker for many, many years prior to that. And I did a lot of these licensing presentations during my tenure with UWM.
Okay.
Hey.
Um, I
Maybe
think we
maybe just about 15 more seconds to answer the polls, and then we'll go ahead and share that, and then we'll get started.
It does look like a few more folks joined us. So for those of you, you should be seeing a poll that helps us kind of know who is in the room.
Right.
And we're going to
So
end
you're
it.
welcome during the presentation today. Please ask questions. It looks like right now we've got about 20 people here, so you can unmute your mic and ask a question. You can raise your electronic hand, or you can post it in the chat. Because we want to make sure that at the end of today, the hour, we have a lot to pack in an hour, that you get your answers to your questions, and then you will get a copy of the PowerPoint. And there's a lot of links in there for the information, so you might want to make a note while you're watching this about which slides have the information with the links that you might be interested in accessing afterwards. All right, so we have um, most of you responded, and we've got looks like a equally number between certification, application, the APSW, and then a couple of you are here for the LCSW. Um, Most of you have not taken the exam. It looks like one of you has. And have you completed your licensing application for your about three of you have completed the application, and most of you have not. Okay, that's great. So I again know how much time to spend. To really get through all of this, it's um, going to be difficult. So I'd like to focus on the areas that you're most interested in. But again, you'll have access to the PowerPoint so that you'll be able to go back and refer to that for anything that you know, forgot or wanted to dig deeper in or go to the website. All right. So there are four categories of social work regulation in Wisconsin. Wisconsin was one of the last states to develop social work a licensure, and when they did it, they really sort of did it in a big way because some of the requirements are more rigorous than some of the other states. And I'll, kind of share with you some of that. But so the CSW is the BSW level, certified social worker, and then the CAPSW is a certified advanced practice social worker. And these are there are different terms in different states. So this is not a national classification. Certified independent social worker, and then licensed clinical social worker. So these are the definitions. I'm not going to read this all to you. I think the big takeaway from this is in Wisconsin, and this is one of the areas where they, have a pretty rigorous way of addressing social work licensure. They have a, restriction on saying that you're a social worker if you're not certified or licensed. You can use your degree credentials. So for all of you here that are not certified or licensed, you can say, I'm a BSW, I'm an MSW, I'm a PhD, I have a PhD in social work. You just can't say I'm a social worker. And for licensure, you need to make sure that even if you get your certification or you get your APSW, You cannot provide clinical social work services unless you're a licensed clinical social worker or you're a clinical social worker in training, and I'll talk a little bit about that in a moment. I always say when I do a lot of trainings for social work professionals and counselors, and I always tell the those that are in have degrees other than or credentials other than a licensed clinical social worker, or maybe they don't even have a social work degree, they have a human service degree or something else related. I always say stay in your lane. You don't want to present as a therapist, so it's just important that we follow the expectations of the Safety and Professional Services, which is the name of the department in Wisconsin that oversees licensure. Again, if you're a APSW or CAPSW, you can engage in psychotherapy if you're properly supervised. So that would be after you get your APSW, then you can begin to work under a qualified supervisor to begin to earn your postgraduate hours. You cannot start earning, accruing clinical hours in Wisconsin unless you have that APSW first. Now that's kind of a problem because there is been some issues with the licensing exam, the pass rates. And if, for students or, social workers that can't pass the APSW and they want to be an LCSW, it's a real obstacle. So we'll talk about a proposal that was actually NASW has spearheaded in a few minutes that might address that if it goes through. If you have a master's or a PhD and have completed 3,000 hours of postgraduate full-time social work practice under the appropriate supervision, and you're certified by the Department of Safety and Professional Services, you can engage in psychotherapy if properly supervised. So that's the independent social worker. Okay, any questions on that before we get into the application? Um, Well, Nadir will watch the chat in case somebody pops up. So Wisconsin Department of Safety and Professional Services created this License E online portal. So the first thing you have to do if you haven't done so already, you have to go in there and create an account because you really can't do anything until you do that. Here's also the website with a link. And so if you want to go and look at the social work forms that need to be filled out, you're going to go here to this main page here, and then you're going to click on A to Z professionals list. And then you could see that it's all alphabetized. So you'll scroll down until you get to, if we can page down here, they don't have a page down option. You can see how many different professions are licensed. So you're going to find the appropriate social worker, a license category that you're looking to pursue. So let's just say you're looking for certification. You've got a BSW. You're going to click here into social worker, and then you'll find if you look on the right, all this information. We'll talk about getting a temporary license, and here's all the forms and the links to them, and they're all fillable online. Um, So I'm not going to go any deeper into this. I just wanted to make sure that you knew how to access it so that you could then bookmark this page so you could have easy access whenever you need to go back and fill out, additional forms.
Jeannie, can I just add really quick? A lot of the forms right now are kind of like PDF, and the Department of Safety and Professional Services across the board are moving to more online forms and using forms within the tool called License E.
Mm-hmm. Right, that's true. They're fillable, not online necessarily here. They're PDFs, so you fill them out, download them, and then you upload them into the site. But they're moving away from that, and they're going to be doing it online, application forms. Okay. There's a temporary Act 10 credential that you can also apply for. And here's this is if you're a provider in good standing in another state. I don't know if anybody here, I know there's one person that said no, that they were from the north. I'm not going to probably go into this, but um, for somebody who's licensed in another state, in a social work license at one of those levels, and they want to provide services in Wisconsin, there's a temporary credential they can get. And then this is the link to that. So again, I posted the website for the forms and all the information about how to apply and what the fees are. You can also go in person if you choose. Here's the phone number. I don't know how responsive they are these days to answering the phone. Um, They've been very short-staffed for a very long time, and it's been a pretty controversial issue because it's not a funding issue. The licensing fees that all of these professions pay every single licensing period has really substantially given them a big windfall of money. But fortunately, politics comes into things, and that has influenced their approval to hire for the people to fill the vacancies. So at one point they were 50% staffed up. Even though they had the money to hire people, they weren't given permission to. And I don't know, Nadir, if you've heard anything about any movement with that lately.
They're still struggling for the proper staffing. They're better than where they were before, and part of why they're better than where they are before is because with the application moving online, their review process for the application has moved quicker than it used to be. It's averaging, I think right now they're averaging 5 days for 5 to 6 days for health professions, which is what the category we're under. So what they would recommend you do is that under the same portal where you would apply. There's a ticket option. They recommend that. There are also emails on many of the websites, and they would encourage folks to do that. Calling is probably a last resort. One time I called and they told me to put in a ticket. So,
Yeah, yeah, that's good advice, Nadir. Thank you.
and then really quick, they have 5 to 7 business days to respond. That's what they give themselves.
Okay. Well, that is better. It was several weeks before. Um, so the application, this is the state law exam, and I have a link here. Anything underlined in this PowerPoint is a link to the actual site that gives you the information. So this is also through the Department of Safety and Professional Services. You can also see at the very top here, rules and statutes. And that's where you can actually click into there and get the rules that you're going to, and the statutes that you're going to be tested for. So, you can order a book and pay for it, or you can actually, when you're taking this exam, which is open book exam, I recommend if you don't want to pay for a booklet, like, I don't know, was it $30 or something? You can open up like a tablet and have the rules and statutes, available to you while you're on your computer taking the exam. A lot of people do it that way. But anyway, it gives you all that information here. It's not difficult, that particular exam. I mean, again, you just have to refer to the particular code that they're asking about. Passing grade here is 85%. It's untimed, so you can exit and return anytime over a 3-month period, which is really good. So, it kind of shows you they want you to pass. But they do also want you to understand what the laws are, because if you're licensed, you are required to follow the laws, administrative laws and other, other federal laws, state laws, etc. Once you pass, well, here's I kind of skipped over this. The state exam consists of material, again, taken from these statutes. And here's the chapters. So they're spelled out for you here. It's not the whole Wisconsin state statutes. That would be overwhelming, and it's not relevant. So these are the 5 chapters that you want to focus on. Um, and from the professional specific code book, they have the pages here and chapters. Once you pass the state exam, it's good for 5 years. Okay, so you won't have to take it again. Even if you take the national exam and you don't pass it, you don't have to take the state exam again if it's been, less than 5 years. And then this one goes to, no, it's the same page there. I just have two different links to it.
Jeannie, there's a couple questions. I'm going to ask the state statute question, and then there's some other ones that I'll get to.
Okay.
Um, if you've taken the state statute exam for another license, do you have to take it again?
No, as long as, no, you don't have to, as long as it's been 5 years, less than 5 years. If it's been over 5 years, then you have to take it again.
So I took it in 2023, and then when I went in, it's still telling me to take it. So do you know what I would do?
Did
Saying you still got to take it. I'm assuming it's the same one I took for my SAC.
the only, do you have a record of it? A document that shows that you passed it in?
Hmm. I don't know. I could look for that.
Yeah, always keep your records, and I would also scan all your records that you have because you'll need these in your career too. So make sure that you're organized because it's very frustrating when, you're trying to produce these documents. So that's what I would say. I would go make sure that you did pass it and what the date was, and then I would um, scan it. And then when you communicate with DSPS about why you were asked to take this again, you took it in 23, you can forward that document to them.
Okay.
Maybe it didn't
Thank
get
you.
data entered correctly. I don't know.
All right. Thank you.
Hmm.
Um, and I think that the system, Jeannie, I think the system that they use, um, they're not always tracking exactly where it is because they're changing some things. And I would recommend that you re-upload the results to there. There was a question about should I redo that? Um, and then if I have an MSW, do I need to take the CSW before taking the APSW?
No, you don't. You don't have to take a CSW. You can just go take the APSW. It's just the only time you have to have a pass one level is when you wanted the LCSW. You have to have had passed the APSW first.
Okay. And then Um, there was a question about a virtual option for taking the licensing exam, which we know the state statute exam you can take virtually because it's in your home. Um, but what about the national exam? Do you know if
There's no
there's
no, they don't have any accommodations for that. You have to go to an actual testing site. Now, that's through ASWB, not through the Wisconsin Department of Safety and Professional Services. And again, they are the ones that create and monitor and update the exam. I'm going to get to them and show you how you can keep up with as they begin, when they've been in a change effort because of, many, many things that were problematic. So, but currently, unless something's changed, like really, really currently that I haven't heard about, you have to go to one of the test centers.
okay? And then James asks, I did see a CSWT certificate on the DSPS website. Does a VSW intern need this certificate to begin a practicum? I assume the answer is no.
No, you don't need any kind of certificate to start at practicum because you're doing that under the umbrella of, your university, your social work program. So you're doing that as an extension of your education.
And then
No, the account, I'm just reading here, Hannah. The account information for licensee is not the same as that is Wisconsin specific. The ASWB is going to be a different account because that is the national organization. It has nothing to do with the Wisconsin Department of Safety and Professional Services.
but you do need to start your Department of Safety and Professional Services application
Yeah,
before.
filling it out. They're
Yep.
right. That's right.
Yep.
You fill
And
it out.
then,
They have a link to getting you in their system and at AS
yeah,
for ASWB.
yep. Um, and then, Michelle, we will touch on a little bit later about accommodations for ASWB. And then I don't know if maybe you want to continue for a little while.
Yeah, yeah.
Sorry.
That's okay. So here's a national exam. This is the cost. Again, we at NASW have advocated not to charge, if somebody doesn't pass the exam, not to charge them for a retake. We have, we have sent these recommendations in writing. We had a very large list of recommendations to ASWB, and sadly, they ignored, I think, most of the recommendations that came from us as well as other across the country. It wasn't just Wisconsin, but it's been frustrating. So, and I just, I have a hard time justifying how they justify keep charging people for taking an exam if they didn't pass. But the time of the exam is 3.5 hours, and you will receive authorization to make an exam appointment after your application materials are all received. Now, this is a link here to ASWB, the exam itself. So this is their page, and I just, went right to the page. So here's where you can get, all the information about the exam. You can download this guide. I did it today, and it didn't charge me for it. So I'm assuming they are making that available at no charge. And again, finding out more about the transitions. So you see that the back block here on the left. The social work licensing exam are changing on Monday, August 3rd, 2026. These changes are part of the ongoing cycle of research and updates. So I am not sure what exactly is changing. I know that they had talked about they were piloting changing the multiple choice. It's all multiple choice. They were piloting changing the multiple choice option from 4 choices to 3 choices. I don't know if that's part of what they're doing. They don't really tell you until they roll it out. And here is an exam materials and resources. You can click into that. Um, you can purchase an online practice test. We recommended having it free of charge. Apparently, that's not happening. There's also websites that you can take a look at that do have, like they'll send you a question a day, licensing question a day to kind of do like flashcard type stuff. Um, and then there is a practice test here. You get to purchase it at first, and then you can log in. But there is some, when you do this guidebook, there are some sample questions for you. Okay. Here's the e-booklet. I just made a link directly to the booklet itself here in this slide. Um, and NASW Wisconsin has exam prep workshops. Can you talk a little more about those, Nadir, and how often and what?
So we've teamed up nationally to offer a workshop. It's very extensive and it offers the book, and I will put a link to that. And then t about twice a year we offer one that's shorter and it's offered by a a retired professor. And the next one that we're going to offer will be part of our fall conference, and that's in person and it's much smaller group.
And are those ones that are offered by NASW Wisconsin? Is there any fee for that?
Um, there is the state specific ones that we offer. It's free for members and there is a fee for non-members. And then the national one, there is a fee. It's reduced for non-members, and you get kind of the book that a lot of people use by Don Apgard.
Okay, thank you.
You're
Any questions on any of that?
welcome. There did seem to be a few. Um, there was it says on licensee, and I think I answered this already, but I thought you might want to answer too. Licensee, it says that we're approved to take the exam even if our application isn't complete yet. And I
Um, uh, uh,
and part of why that is the case, I know you're going to get to it, is because one piece of your application being complete is your school submitting
oh, right,
the
that's correct.
information,
Yeah,
and
yeah,
that obviously can't happen until you graduate, but you can take the exam before you graduate. So, but you do want to get your application started um, before you try to take the exam.
yes. And it is best, it is recommended if you are still in school or you just got out, you just graduated in May or, even in December last year, the sooner you take it, the better chance you have of passing it. And that also is what the some of the research findings that ASWB found when they were looking at pass rates. The problem if you wait too long to take the exam, a lot of times you will, when you look at these questions, these vignettes, you'll consider your practice experience and how you would have handled things. Well, the exam is written in a best practice model. So the reality is that nonprofits across the state and country, a lot of them don't necessarily practice best practice models. I mean, they've got limitations with budgets and staffing and maybe the state they're in and regulations and resources. So they do the best they can. But what they're looking for in answering these questions is that you are responding to the best practice, model. And the longer you're in the field, the farther you may get away from that because you're not going to remember the details of what you learned in your educational program. Okay, and here's just the names of the ASWB exams. So it's consistent with the name of the particular license you would get. Now, because as I mentioned earlier about the pass rates being a problem, and it is reflective of race, ethnicity, age, um, abilities. Like people that are deaf have a lower pass rate than those that don't, and also your primary language. If you're using, well, that's one of the reasons I think people that are deaf have a difficult time because they use American Sign Language, or if you're not, if English is not your primary language. Um, so it's there's a lot of reasons. I don't want to get into all of it because it's very complicated. And again at NASW we did a very good job of trying to communicate our concerns as well as numerous social work programs across the country and organizations. But they have ASWB has been working towards addressing these disparities. Um, well, we'll have to wait and see. They're going to have this new launch next month. So we'll wait and see what happens. And I'd love to see if that actually improves the pass rate. Okay. So the alternative in what Wisconsin has proposed, it hasn't gone for a vote in the assembly. Um, and I don't know if it will pass, but basically they want to provide an opportunity to get a provisional social work license. So if you take the exam and the ASWB exam, the national exam, and you don't pass it, Wisconsin, what we're proposing is that you can apply for a temporary license if you're working under a licensed social worker in good standing. Um, and then complete the hours that I think it's going to be is it 2,000 hours? Yeah, 2,000 hours of supervised practice. And then that supervisor would sign off on them. And then you would be able to just transition your temporary license into the regular license. That's what we're proposing. We did have some support in the assembly. It hasn't gone for a vote, and I don't know, well, what the outcome of that is going to be. Do you have any more to add on that, Nadir?
Just that I know it's a priority and we'll be bringing it back up in the new legislative session. And it's very important to think about the folks that will be in office. So your vote can make a difference on this. Um, and then I saw the question about you said it's 3.5 hours for the exam, but folks have heard that it's 4 hours. And I just tried to look it up, and it does appear now that the exam is 4 hours.
Okay, they must have extended it because this PowerPoint was from old, yeah, some of that.
I think that's part of the new change. So I'm
Okay,
not sure that
good,
that's
good to know.
so many changes.
Make a note of that. Um, okay, so for somebody who wants to go from an APSW to an LCSW, and I know that there was two people here, so I'll kind of go through this quickly since there's only a couple of you, but to be a licensed clinical social worker, you have to have a master's or a PhD in social work and completed the required master levels coursework. Well, what is that? Well, normally, if you're in an accredited social work program, which I'm sure you all are, or graduated from one, you have your methods courses or practice courses. They usually meet the requirement for some of these. And then the big one is adult psychopathology. You have to have had that, and there has to be, a documentation of that. So if you haven't had that, then you're going to need to take it at one of the universities. And there's a lot of them online now. So maybe if you're employed, maybe they'll help you with the cost of that. And then after you get your MSW or your PhD and you do your postgraduate hours is between 3,000 and 4,500. Okay. And I'll talk about the difference. Why is there a variance between the 3,000 and 4,500 in a minute? You have to have 1,000 hours face-to-face client contact. You have to use the DSM to diagnose and treat individuals. So you can't be placed in like a hospice program or domestic violence program and get credit for a clinical field placement because that's not considered clinical. You have to be supervised by somebody approved this by the social work section. Um, let's see, supervision was approved after supervision by a licensed clinician meeting the Wisconsin DSPS requirements. So I did click into this too. If you're in this situation where you need to be supervised, well, I don't know, this is not loading yet.
Oh,
Okay, well, there it goes. Okay, so this is from the Wisconsin oops, um, Department of Safety and Professional Services. This is the MPS W4, and that tells you all of the requirements for pre-certification or pre-licensure and qualifications for supervision.
um, Jeannie, can I just jump in really quick and add two things?
Yeah,
Uh, First, you will want to keep track of the syllabi from all of the courses you take, especially the one that DSPS wants to see. Was on a meeting today where the reviewers were saying they really like seeing that attached as part of your application. And then, especially if you're getting supervised by somebody who's not a social worker, you want to get that approved before the supervision because it's really awkward to try to get that approved after or while you're doing the supervision.
right. Um, once you have your degree and you're under the supervision of an approved supervisor in a clinical setting, you can engage in psychotherapy under supervision. That's obviously how you're going to be earning your hours that are required. Um, so this just kind of summarizes it. And the 3,000, so the 3,000 is if you've had a clinical field placement for 2 semesters that meets that criteria. It has to be like in a primary mental health setting where you're using the DSM 5TR to diagnose and treat clients. And it could also be in an AODA program. And if you didn't have that kind of clinical, and there's a form you have to fill out, and the person who supervised you fills it out or fills out their part and signs off, or you can go to your field director, field liaison that you worked with when you were in your bachelor's or your master's program, and they can also sign off on that form. 2672, I believe it is. Um, and if you don't, again, if you don't have the clinical experience from your internship, maybe you were in a macro placement, for example, then you have to do 4,500 postgraduate hours to get to apply for the LCSW. Any questions on any of this? Okay. 600 of the 1,000 hours must also consist of diagnosis and psychotherapeutic treatment. your supervisor does not necessarily need to be your employment supervisor. So maybe you're in an agency where your direct supervisor is actually an APSW, but not an LCSW. You can actually see if you can get the um, other person to supervise your clinical hours. I did that when I was in my grad or after I got out of my grad program. Okay, so what kind of
Um,
experience?
oh,
Go ahead.
really quick. NASW has launched a supervision connection program. And so if you're a member, you can log in to this site and you should be able to be directed to learn more about who can supervise you. Also, you can always reach out to me if you need assistance.
Oh, okay, perfect. He just put it in the chat. Thank you, Nadir. I know we were
You're welcome.
working on that. I didn't know it was official now.
I know I sneak so much in there.
Yeah. So I this is kind of redundant here. Just wanted to make sure that you understood, what clinical social work is. Supervision can be with an LCSW in good standing, a psychiatrist or a psychologist. If nobody with those credentials is in your agency, then you can see if one of the others, like somebody with an LPC, licensed professional counselor, licensed marriage and family therapist, or a psychiatric nurse, is willing to provide your supervision. And if they are, then they have to request approval from DSPS, and there's a form for that. But it has to be done in advance. Okay. Supervision should average 1 hour a week. And group supervision is allowed up to 6 individuals in the group supervision. And video conferencing is now allowed indefinitely. It was actually implemented during COVID, and that was part of the HIPAA changes. And that has, I just looked that up today, they've actually allowed that to continue, which is good. Um, and here's the years of postgraduate experience that's required. These are so the experience threshold by profession. And as Nadir mentioned, we worked on this NASW supervision course to provide, the experience or the education for people that wanted to be supervisors. I know I'm licensed in Illinois, and we're required to take a supervision course I think once every 2 or 3 licensure periods. Okay, so this is again, they have to be in good standing. I already mentioned that. Yeah, this was a conflict. Nadir, you may want to look this one up because this is
It's
was
changing. It's changing, and I think this isn't the
okay.
time to get into it, but it's changing.
It went from 3 years to 5 years, correct?
It's going the other.
It
It's
went
going
from
the other.
five to
It's
three.
so if you've been practicing, I'll explain this. Like I didn't want to. If you've been practicing for 5 years or more, you won't have to take any supervision course to meet the state requirements. If you've been practicing between 3 years and so 3 or 4 years, you will have to take a supervision course requirement for the state. Um, and they're going to require it to be 30 hours or a class you took while in graduate school. I'm not sure on the timing of when that's getting implemented. I think it's going to be after the licensing cycle. That's probably more than you all wanted to know, but it's coming.
Okay, thanks, Nadir.
You're welcome.
Things are always a changing. And then I'm not going to get into this. I'm not any sure if any of you are looking to get your SACIT, but this is the link to the Substance Abuse Counselor Specialty Classification. And they did also, make some recent changes in this. So this will provide you with all the information that you need, how many hours you need, the supervision, etc.
Elena asks, with the compact coming, will supervisors have to remain in Wisconsin or is that not relevant? Um,
I'm getting to the
currently,
compact. I will get into, we have
oh, okay,
compact is one of the topics here. Yeah. Hang
fine. Then
on one
I'll
second.
wait. I'll wait.
Yeah. Um, Another thing that's changed in recent years has been the MPS, the or code of conduct. And the code of conduct is what's required of all licensed social workers and counselors that in the state of Wisconsin. So I have a link to it, I think, on the next page. But you absolutely are going to need to know what's in the code of conduct. It's only a two-page document. But some of the changes that occurred during this last version was that they require you to report child abuse and neglect. And the code of conduct basically is to ensure that you're operating under the expectations of the Department of Safety and Professional Services. And so if you violate a code of conduct, then you can be brought in front of the licensing board and you could be risk of having your license suspended or terminated. And that doesn't happen very often, but it can happen. So, just so you know, um, they do have a thing called a temporary certificate of 9 months. That's the one that I was mentioning earlier. Um, Malpractice insurance is required for clinical social workers. And the continuing education requirements, 30 hours every 2-year licensure cycle, and 4 hours always of those have to be in ethics and boundaries. And it also provides for privileged communication, so you get subpoenaed. Um, you do not have to testify to break confidentiality.
Yep. And
James, go
then
ahead. You have your hand raised.
Hi, just real quick on the required to report child abuse and neglect. Is that part of the mandated reporter role that we are fulfilling? And
Yes.
also, does that mean that we are required to report um, things that we have witnessed or suspect when we are not working?
Um, no. The mandated reporting is affiliated with the role that you have as a professional. However, I will tell you, as a mandated reporter my whole career, um, I still did report things that I found personally, or in my community, but it's not something that you could be a violation of the code of conduct if you did not. But it is related to the role that you have, so in your capacity as a social worker. So I'm not going to get into this because this is just, some of this content just for me is new because Mark Herstad did this. So these are some of the things that he liked to cover when he was doing the training. Psychometric train testing, just so you know, there's a process you have to get approved to do that. It's not just automatic when you get your credentials. And here's a link to it so that you can read all about it if you want to understand more about what is in the psychometric testing and what the process is to get approved. I mentioned this already, the 30 hours for the credential period. Ethics has to be in an interactive format. So in other words, it has to be either live in person, in a synchronistic like we're doing right now, real time online, or there are some that are on demand, but you have to post from a discussion forum, and you had to be interactive in that process. And you should keep your records for 4 years. So every time you get a CEH certificate, keep that in a place that you can easily access, because sometimes Wisconsin DSPS will do audits and they'll randomly pick people. And then you'll get a letter when you want to go to renew your license, and it'll say, we want to see proof of all your CEHs that you said you completed. And that was the number one type of violation of the code of conduct that occurred a few years ago in Wisconsin. People were saying, I did my CEHs, and then when they had to prove it, they didn't have them. And they got called in to, DSPS for a violation of meeting the requirements for the continuing ed. So keep your records. Most places will, oops. Most places that you work at will provide a lot of it through an in-service format, which, doesn't need prior authorization. Well, that's this slide right here. So, um, of those 30 hours, you can have 15 of them as an in-service, as long as it's related in some capacity to social work. or what you're doing in your professional role. And you just keep that you should get a certificate from your organization, and that's part of it. The other 15 hours have to be done outside of your employer. And this is all the links to, what's acceptable for continuing education. And it's the statute is MPSW 19. So there's two links on the slide that you can get into to learn about what the requirements are. But NASW is an approver, as one of the many approvers of these continuing education courses that are being provided by not a university, but maybe it's just a professional organization or something. Okay. Here's a link to the code of conduct. I'm just going to click into this real quick so you can see, what it looks like. You can download. You can see it's not very long. When you do a PDF, it's 2 pages. So, but anyway, you'll have access to that. Okay. And then these are some of the other changes with MPS 20. They have a specific thing about your responsibility, ethical responsibility for accurate and timely record keeping. Believe it or not, they didn't have a lot in the previous version about having sexual contact with former clients. Now they do, and they also address personal relationships with former clients. Finally, we advocated for years to get conversion therapy banned as a code of conduct violation. Finally, it actually happened, and that's what happens when you have a change in Supreme Court judges in the state. That's how we got that through. Not reporting a misdemeanor or felony conviction you've had to DSPS after you get your license, you have to report anything, any kind of conviction, even like I say, a misdemeanor. Um, and complying with, I mentioned the complying with child abuse and neglect, not providing adequate supervision if you're a supervisor to a supervisee, and then they um, get brought before the licensing division, and they said, well, yes, I did violate the code of conduct, but that's because my supervisor told me I could do that, and you're the supervisor. So that's the type of situation where you could be called in to this DSPS. And withholding documentation of supervisee's clinical experience. That's if you are under the supervision of somebody when you're trying to get your clinical hours, and then maybe you have a falling out in the relationship and you did 1,000 hours with them, and you now need to prove that you did those 1,000 hours, and you ask them to sign the form, and they say, I'm not going to do that. I don't like you. People were doing that, and I got a lot of phone calls about those types of things. Now they say that is a violation of the code of conduct for the supervisor to do that. They have to sign off on those hours. So with the criminal offenses that I mentioned, that you have to report if you were convicted of something, and you go before the board in order to determine whether it would affect your license, they use the language that it has to be substantially related to social work practice to disqualify you. So if it was a tax evasion thing or something like that, it would probably not affect your license because it's really not, essentially related. But if it was something that you harmed a child, or, were involved in a felony for some type of armed robbery or something, that would be an entirely different situation. But you have a chance to, present your evidence to the social work section. These are the standards for record keeping. I'm going to kind of go through this fast because I want to get through the rest of the information. And then any agency that has licensed social workers, if they fire them for, incompetence or some ethics violation, they have to report it to DSPS. And this is the language there. And here's how to report a termination or complaint. There's all the information here. Reimbursement. Most insurance companies will reimburse advanced practice social workers. If you're providing psychotherapy in your postgraduate hours, the agency can get compensated. as long as you're, it's a state certified mental health clinic. They also reimburse LCSWs and LPCs. So, we're getting that, but that was a big thing because the social workers actually got that first. So that Medicare and Medicaid, they can provide services under those two large federal insurance policies and can get paid. Wisconsin Medicaid also reimburses for telehealth, and so does Medicare. And insurance companies, that's always changing. They're currently reimbursing for mental health, but some of them have threatened not to do that anymore, and I don't know where that's at in Wisconsin. Reciprocity, that's if you're licensed in another state, do you automatically get a license in Wisconsin, or if you're licensed in Wisconsin, do you automatically get a license in another state at your same level of credential? No, because there's not a lot of reciprocity that happens across state lines. Each state has their own requirements. However, that gets us into the social work licensure compact. So essentially, what that means is that, and I'll show you how far we've gotten along with this, but essentially what it means is that if you're licensed in Wisconsin, and if Wisconsin is a compact state, which it is now, yay, we really worked hard to make that happen. Um, and your client that you're seeing is wintering in Florida, and they want to continue to get counseling services, and you're not licensed in Florida, but if the Florida was part of the interstate compact, then you could seamlessly provide psychotherapy across the state lines. Okay, so here is oh, the page isn't, I just linked into this page. Okay. There's a lot of most of the states now, a lot of them are in line with the compact. um, it's not yet implemented. I mean, it's not, so even though Wisconsin has voted for it internally at the assembly level, and it's been signed off on by the governor, um, nobody in social work across the country is yet operating under the compact, because the actual organization that is overseeing this has not got it all the details finalized to be able to roll it out. And so I just looked it up today before I did this, and it looks like they're saying spring of next year. Oh, here's the map here. So I wouldn't hold my breath, but so sometime I would say in the next year and a half, the compact should be up and running. And these are the blue states, are all the ones that have had it approved. The light blue, they're pending, and the gray ones, unfortunately, Florida, which really needs to because they have a lot of people that winter there, they have not yet got it approved.
Um,
All the states may jump on board here either.
And then yellow, it means they've made such significant changes to the bill because in a compact, things have to look the same. That the folks who are running the compact are saying you basically have to redo the bill. What I would say is in Wisconsin, it does look like probably spring of next year is when we get it implemented. That there's two phases. So as you were mentioning, Jeannie, there's the national, everything getting done, and then there's us at the state level being ready. And
Right.
honestly, one of the concerns we have is that DSPS and they're being understaffed, that they may have difficulty fully implementing the compact. The good news, I was in a meeting today and they said, hey, this is the same software and technology system that we're using for other compacts, which should be a good indicator for them. And then what will happen, again, we don't fully know. Most likely what will happen is you will choose in Wisconsin whether you want a, a compact license or a non-compact license. The compact license will probably cost a little bit more because of the software and technology that's needed to help administer that. We don't know what the fees will look like for the compact license at this time in Wisconsin. And then I'm going to ask you, Jeannie, this question. With the compact coming in, will supervisors have to remain in Wisconsin, or is that not relevant?
No, no, so with the compact, well, you don't have to have the supervisor there. You're talking about supervision for crewing hours, or? Yeah, no, you don't have to be in the same state. There's a lot of supervision that's done through um, telecommunications. So if you start clinical hours in one state and had to finish in another compact state, do you know if it will transfer? Well, you don't have to. Once you get, like as Nadir said, once you if you're licensed in Wisconsin and you apply for a compact license, then you should be able to provide services in the state that you're moving to. I don't know if you'll have to register with that state. I would guess you would have to do something, but you should be able to pretty seamlessly provide services. I mean, that's the whole intention of this is to make it much easier for people to get mental health services.
And Elena, I would say some of the rules about kind of the in be I'm gonna um some of the rules about like you're trying to get your hours. Those are some of the things that they're finalizing. We kind of have a better understanding of what it means once like you're a fully licensed person, but some of these in between areas are the things they're finalizing. I know you had your hand up. Is there anything else you wanted to ask?
No, sorry. Yeah, I just wanted to clear up that I was
What?
saying like when you're like accruing hours for your getting your LCSW and say you had to move in the middle of it. For context, like I'm a military spouse, and I know there's like a lot of military spouses that kind of move in between like getting licensed and getting their degree. And so I was just curious if that was something that was being thought about, like the in between, kind of like Nadir was saying.
Yeah, the clinical experience isn't specific to the state you're in. I mean, and also just think about it with all these online programs. I mean, there's more social work online programs than are actually traditional now. So yeah, the whole purpose of and even the compact is to remove the obstacles because there's been so many. So I think you should be fine there, Elena.
Yep. But my recommendation would be making sure that you connect with your current licensing board and whatever future licensing board you have, and making sure that they're all communicating, especially as we get in this kind of the first, I would say the first 2 years of this, because we're all still going to be figuring out how this gets implemented. Being in the military should really help though, because they're going to kind of be leading the way on this.
Yeah.
Thank you. Um,
You're welcome.
and sorry if I missed this, but does all of your clinical supervision hours have to be completed in person? Like, or is there a specific point you can like do telehealth to complete those hours?
No, they don't have to be all in person. You could do telehealth. It's just that it all has to be supervised. It doesn't mean that your supervisor has to be in your counseling session for every session. That's not what that means. But certainly, they have to have a mechanism to assess your clinical skills. So hopefully, that would be one of the things they would do is occasionally join you, or if the client was agreeable to recording it so they could view it, and then certainly debrief with you, afterwards, so that you can process what transpired and what your treatment approaches were. Other questions? Again, I just want to say sorry for some of the conflicting information, but everything is in transition right now. So it's really hard to keep up with it. ASWB is in transition, Wisconsin, Department of Safety and Professional Services. We've got recommendations to have an alternative to the licensing exam that's in question. Then we got the compact, and we keep getting different information about that over the last few years because this has been going on for a while. I think we're finally on the home stretch with that, but so it's just a lot to keep up with because they're
Uh,
different systems too. So
And then, Jeannie, I just wanted to make something really clear. Right now, under the compact, if Wisconsin if we decide to get an alternative licensure path in Wisconsin, you cannot, under the current plan, um, apply for a compact with that alternative path. There are
right,
NASW chapters because the language says that there has to be a nationally accepted alternative path. No two states right now are doing their alternative path exactly the same. NASW chapters, and I think Texas is leading the way, are really trying to start that conversation about what can be some accepted, what can be an accepted alternative path. But that's going to probably take some time before we
Yeah.
get that implemented.
Yeah,
So,
thanks for bringing that up because like Illinois is one of them, and that's why they're still not doing it because they were so appalled by the pass rates, the disparities with race, ethnicity, etc., that they decided that they would forego the requirement for the licensing exam. And in with Illinois and some other states, all you had to do is graduate from an accredited social work program and apply for the license at your level. Not the LCSW, still to do the clinical hours, but for your CSW or APSW, all you had to have is, that degree from an accredited program, and then you could get licensed in Illinois. But now with this compact, as part of the requirements, they're requiring everybody to have taken the national exam and passed it. So the states that implemented no requirement for the exam are trying to figure out what to do. All right. Any other questions? No, looks like we're out of time here. All right. Well, thank you so much. And Nadir will send you the PowerPoint and good luck.
yep. And thank you all for being here. Have a great rest of your night. I will send out everything.
All right. Thank you. All righty.
I have a quick question, if not, if that's okay.
Go ahead,
Sure.
Michelle.
Sure.
So for the